we have young people being diagnosed with adult onset diabetes. I'm talking 12, 13, 15, 16-year-olds. We are seeing the cost of diabetes go up exponentially. Well, a lot of insurance companies will not pay for someone who's pre-diabetic or been diagnosed with diabetes to go to a nutritionist to find out how better to feed themselves and their families, to go to a podiatrist to have their feet checked. But they will pay if you have to have your foot amputated. Because the reasoning is, and the insurance companies will tell you this, they don't want to pay for preventive health care because that's like a lost amount of money, because they're not sure that the patient or the insured person will still be with them. But if they're confronted with the doctor saying we're going to have to amputate the foot, they're kind of stuck with it. That is upside down and backwards. So we could save money if we change the incentives to require that preventive health care and wellness be covered and incentivized, and we could require that every insurance company had to insure everybody and no exclusions for pre-existing conditions. And that would be one thing we could do.
Senator, right now I'd like to turn things over to Courtney Arrington, who, in her job with the Clark County Housing Authority, sees every day a lot of the kind of people you're talking about, people who have coverage but can't afford their health care.
Right.
Courtney, are you here?
Here's Courtney. Here. Hi, Courtney.
Hello. As you know, I'm Courtney Arrington. I'm a proud member of SEIU, and I work for the Clark County Housing Authority. Many of the people that I serve on a day-to-day basis are low-income families, seniors, and disabled people living on a fixed income. Many of them have health care, but still spend a lot of money out of pocket, which honestly they can't afford to do. So how and on what timeline are you going to rein in the health care costs?
It's a really good question, Courtney, because if we don't get costs under control, you can have a universal health care plan and it'll still keep costing more and more money for everybody in it. And then we'll be back right to where we are today. So I want to do several things. Number one, as I said, I want to end insurance discrimination and make it clear that they're going to have to be under some restrictions about what they can charge people and what they can and cannot do to them when it comes to their insurance. Number two, I had a bill that I worked on for 4 years in the Senate to move us toward electronic medical records. We passed the Senate. We didn't pass the Republican House. We're coming back to make it happen. Why do I mention that? Thank you. Well, those of you in healthcare know the answer. You spend so much of your time, doing record keeping, trying to read records that are illegible, trying to fax records to people who aren't, right near home and need their records. And you go through all of this, misplacing records. We are drowning. And frankly, people are suffering because we have a paper system in the healthcare field. We don't rely on paper in any other big part of our economy anymore. Because we rely on paper, we are wasting money. We can save, by an independent assessment, $100 billion a year if we move toward electronic medical records. And I want to start requiring the people who do business with the government, namely Medicare, Medicaid, VA, you name it, the Federal Employees Health Benefit Plan, they're going to have to move toward electronic medical records. And I'm willing to put some upfront money into that to create a system where all these different healthcare IT systems can talk to each other. Because if you're taking care of somebody here in Las Vegas, they have families, say, in Arizona or LA. They go there, they slip and fall, they go to the emergency room. You start with a history. You start with tests that maybe they took 2 weeks or 2 months ago. After Hurricane Katrina, I went down to Houston to see the people who'd been evacuated, most of them from the convention center, the elderly, the frail, people who were very dependent upon health care. Their records were gone. Those pieces of paper were destroyed. And a lot of the doctors told me their biggest problem was trying to figure out what prescriptions to give to people, because you had a lot of elderly folks who knew they were taking pills but didn't know what they were. They said, look, I take a pink pill in the morning and a blue pill in the afternoon. Had no idea what it was. The only people they could help were the people who had shopped at chain drugstores because they had electronic medical records. If we had that for all of our health care records, we'd get costs down and we'd have higher quality health care. So we got to do all of this at the same time to help get those costs down and to help people.
But, Senator, you've said that you can do this with no big new taxes. So where does this upfront money come from?
Well, I'm talking, for example, on the electronic medical records, maybe $200 million to get the architecture of the system put into place. You know, give or take money, but that's what we estimated when we did it originally a couple of years ago. And there will be some investments. But when I'm talking about how much money we need to spend, let's look at what we spend nationally. It's not just what the government spends, it's what all of us spend. We already spend more money than everybody else. I cannot see us putting more money as a national expenditure into health care without modernizing the system, without ending insurance discrimination, without beginning to emphasize wellness and prevention. People are going to have to start taking better care of themselves. We cannot afford all the illness that folks are bringing on themselves. There are some things we have no control over. There are some things we do have some control over, and we need to start working on that, myself included, everybody else. But what we really have to look at is how can we save money over the long run? So I'm willing to put in some upfront investments to do the right things, and I think we can then save money as we go forward. But I don't think we should start from the position where we say we're going to increase all of these costs by putting more money into a system that is broken. We have to fix the system so it serves people better. It takes better care of those who take care of us, and we take better care of ourselves. And that is the way that I'd like to approach this.
Well, Senator, we're out of time, but I did want to ask you one last quick question. Several of the candidates we have heard from today have said that they think they can get to universal coverage in their first term. You have suggested that it could take 2 terms. It could take 8 years. Are they being realistic?
Well, I think we all are going to try to start as soon as possible. You know, it took 3 years to implement the Medicare prescription drug benefit. Well, you know, I didn't vote for it, but, you know, and this administration does exactly have the greatest track record on competence, so, you know, I can't judge it exactly by that, but it took a while. I think we can move more quickly, but make no mistake about it, this will be a series of steps. But let me end where I started. We're all for universal health care. You know, we had a big debate about it. 93 and 94, that debate's over. The Democrats stand united. We are all for universal health care. What we have to do is persuade the country not only to vote for a Democratic president, we have to help elect a Democratic Congress. Because if you look at the politics of this, and I know that people would rather not think about politics because that's kind of a downer, but if you look at the politics, we got stopped in the Senate in 1994 by a filibuster. You know what that means is unless you get 60 votes, which means usually unless you got more than 60 Democrats, you got to get some Republicans. We got stopped because they basically said, we're not going to do it. And we couldn't break it, and that was the end. We can't get enough Republicans right now to vote with us to try to begin to end the war in Iraq. We can't. We're trying. Every single week we come up with something else to try to get them to vote with us. But the way the Senate works, you got to get to 60 votes. So that's why I said, I sure hope you'll elect me president, but I want some more Democrats in the Senate. And I want a movement to support health care reform, and we're going to need it, so let's make sure that's what we do in the next 2 years. Thank you all very much.